Peace FM 104.3. Good to meet you.
COVID.
Yes.
First of all, no, mebo Ghanaians na abaso. Omo di nhye eye juma. Ena omo madwin se omo mbusa.
Answer na obedru okra me sambo abaso e no buy as usual. You know mask bebre.
Yes.
Inti pacho tabrasa.
Baba me uka no me say Kabila man it so.
Kabila wo de wo.
Jato odi me koko.
Wa di ma koko. Yeah.
So far no, there are three things that have come together.
Yeah.
My COVID situation. I always use the word. It's an inspiring one, despite the unfortunate deaths we've recorded and the unfortunate debilitation. I just complications. Number three, never together. First of all, state support. You can say state support and she or mine and kasa as our mind structure. No government are buying their tool how they board the fight. The second one, or mine no more. In Shaya, like wearing of mask, avoiding crowded places, trying to support the directions of Bayama. And the third one, culture is the way a group of people live. I have a strong belief, say, because I have examples of countries, public health preventive mechanisms, health structure, infrastructure, and we are doing. Now, so they've had thousands of deaths. Classical example is Norway and Switzerland. Although Omar is still how, but yet you compare your strength, no almost strength. Any day it's an impressive one. Once upon a time, our active cases just more virus now. Other people know. There was a time we had over 10,000 active cases. Active, active,
10,000 active.
Yes.
There was a time we had it in Ghana.
Yes, about 10,000 active cases.
Wow.
Nanyankupa Dome at a period no, on the average, we now we're dangling around 5,000 for about 2 months. At the point, after they want say active cases in them around 3,500. The last time I checked, the active case we have as at the last review no, was 1,906. Now, there are lessons to learn from this. Rakami.
Yeah.
Cumulative, just say from day one, cases up to now, no, it's about 41,847. Omoma recover is close to 40,000, 39,718. That's about 94%. Now, say, yeah, come malaria. Now you see, you come malaria from Godgisbeck time to now. One should do more than our population because in a year that you get it 2-3 times. Yeah. So the point I'm making is, say, you really can't tell much based on just the absolute numbers of those who have had it before. But you tell by what you have now, and that's what we mean by the active cases.
Are we not patting ourselves on the back too much? Yeah, more and one basso dodo. Esan say, Munya Yajatum say, Adi still are ye huni soon in the bang.
Good.
But I say, ye boy and one, but oh, yeah.
Say, Mekanebia said, this is one of the topics are very complex in communication. So that you have to walk a very fine line of telling the part of the story that inspires hope, that can take care of depression and fear, and at the same time hammer on the part that preaches caution and why caution is necessary. You must do, you must speak the double at the same time. Now, Sebi, if at a point in time you had 10,000 people who had the virus and could spread it, and now you have 2,000, and just say, yeah, buying Sebi now, but what would your mind usu by no aboy, what I say? Now, Sebio, we've had about 200 plus deaths,
Yeah.
Now, deaths are ebimuye Sebi Fachemi. Known, some are heralded, some are unheralded. Ebi Sebi Obia, Obi Onibi. But the point is that each life is connected to a family. In that family, no, uko catch me say oyare we area osha enye musana one show mu di nyama be diwechi o me proud. So the point I'm making is because we don't know who will be in that 0.5% mortality, no, all of us must continue to take care of us. I don't get out without a mask. na se bi o mi ankasa mi na me doctor I didn't start to cry me was niam bia wan hwa me ya e betimi aboa me kakra na me am me wo niam me no se me di niam me kita sanitizer na me sari mask account na me keep distance. How dare you say that? Odi e unso hwi ba kwa me enti be pacho nhihye aban akoso ye ni nyina would have a meaning or have an impact if we continue to also take good care of ourselves. Now, it is important to mention say Enayekasa is still as a matter of government policy. Once you are confirmed as Obi our COVID, no, Aban takes care of all your bills from the outpatient department through the high dependency unit, even to the ICU. Now, and you say Aban for us to say Kofaya no Brighton or yes, it's because Aban is committed to making sure that the life of the Ghanaian is protected as much as possible. Now, I say this now, yes, we am by obeying and complying to the rules and regulations. Now, if we do this at a point in time, we'll move. When they say President last address, we are in the transition stage. When it started, we were in the crisis management stage. And then I friend public health emergency mode. Just that you've activated all your how do you call it, systems. Second stage, is learning to live responsibly with the virus. Then we can be so I don't know if virus intra mesina near and come with Obama to see Sinaprat. But when we say learn to live responsibly, it's an admission by the scientists that I don't have what it takes to wipe it out completely now, like HIV. HIV started 40 years ago. They started by looking for a vaccine and a treatment. The vaccine they've not succeeded in the vaccine, but they've succeeded at effective treatment. And then your threshold kakra de your population, but sebi people are still advised to live responsibly with the virus around. And to Mikacho be the last I say, yeah, Kasa or Ghana, there are close to 500,000 Ghanaians who have HIV. Now, 500,000.
Yeah.
But why do you still get out into the day not saying that, hey, once HIV virus is in Ghana, hey, let me be careful, I can't even go down. You've been taught the dynamics of the virus. There is a virus that spreads through fluids. So if uko jimoja, make sure that you take it from the right source. Because if the virus is in it, you can get it. The second one too is that make sure that if you meet somebody, it should be someone that said we need the background. Don't leave and engage in casual sex. So the ABC
reckless.
Of reckless. The ABC of what? HIV prevention, abstinence, be faithful, and condom. Sana ya chile upon ya faswa ya di tackle corona. What we refer to as a risk reduction behavior.
Yeah.
The first one is that put on your mask, so that even if Okoboy will be no kasane one from your mask will trap the droplets. Second one is sebio matina minimisa kamutebo yi. Se kabila na okite binodi ewo nsa minimisa fa apemisumefa minimisa ko benimpe ochina betino na okobwe wan eshi enti yesi before odi unsa be ko wenim no use the sanitizer or wash your hands.
Yeah.
Sebi uye nema we a odi obi a ni asem mishi obi o se okobwe me hu virus ni da na me pese me hu no ansa na magina yi rakami sa kasa no me pese me kasa sebi nyanse nim me ka obi be kasa mayiya no babra kwami ya me pese nkofo se ye ka cancer of the liver what she be da
Debbie
o se on she be da fine ya be friend no chondrosarcoma cancer of the bone. Me see what she be da o se me she be da okay your virus be your friend SARS-CoV-2 what she be da o se doctor Dean Kramin da me say okay your Middle East respiratory syndrome MERS and you see a coronavirus what she be da me say now we mu nyina ho she be da o train a she be answer na wa gina yi o se doctor ma gina yi. So the point is that you can't see the virus back at me.
Yeah.
Now virus no ye ni hu anka obi a she da de che. But because it is invisible, the wise man will not wait for carnage before putting his house in order.
This FM 104.3 Good to me,